Welcome back to the program. Let's go to line number 4. Good morning, Simon Lono. You're on the air.
Hello, good day. How are you doing today?
Fair. How about you?
I think a little tiny bit better than you. Happy New Year, brother.
And Happy New Year to you as well. Thanks very much.
I wanted to talk a little bit about healthcare, if I could.
Go right ahead.
There's a couple of interesting stories that have come out in the last month or so that I thought were worth noting. One is a story that came out this morning about the long-term health care facility.
Yeah, I read it.
And how it's not really, at least there are some families who are unhappy about the way that they're managing things.
Mm-hmm.
The other one is the story about the nurses and what they've decided to do about their uniforms.
Yeah. Obviously, that is certainly, I would think, has much less impact and less important than the type of care being afforded in our long-term facilities. But both are interesting. You go ahead and pick your spot.
Well, it's the really interesting thing about the nurses' story is that this really gets to a long-standing, low-simmering complaint about the healthcare system. And one of them is that, from the patient's perspective, they go into hospitals, they feel powerless, they're not really sure what's going on, and they can't tell who's in charge. So when you're sitting in your hospital bed, you can tell the difference between your doctor, your nurse, the person who changes your bedpan, or the person who brings your lunch. And this is a serious problem.
That's a fair point. Yep.
Because they all look the same to you. And in fact, not only do they look the same, I think sometimes maybe the plan is to have them all look the same. But now with the nurses who have decided to go back to a traditional uniform or semi-traditional uniform, that breaks the mold and that makes them distinctive within the healthcare system. And that's a good first step. What's interesting to notice is that this was not an initiative of Eastern Health. This was not an initiative of the Department of Health. This was an initiative of the union itself. And hats off to them for doing this. Because it's going to make, it's a small thing, and it looks like a tiny thing or an irrelevant thing from the outside. But from the inside, from the patient perspective, this is going to make a huge difference to the quality of their care.
Possibly so, and I wouldn't call it irrelevant or diminish it down to anything like that, but it's a fair point and well made. When we can easily identify who is who based on their uniform in the hospital, it does change how we consider the delivery of healthcare and how many nurses are actually on the floor and all the rest of it. So fair enough.
And so the other thing about the long-term health care facility and the complaints that are coming out of there, it's really interesting to notice that, again, from the patient perspective, the patient experience, the system has systematically removed patients and their families from any role in addressing issues in those kinds of facilities before the fact. There's not much in the way of consultation with families or residents, either before things happen or while things happen. It only starts to talk to patients and residents and families after the problems have occurred. It's a complaint-driven system. When there's a critical mass of issues, then we're going to start talking to you about how to resolve them. But in fact, still, the first response is defend, defend, defend. No, there's no problems here. This is the way we do things. It's not an issue. It's not a problem. And that's exactly the wrong attitude to take.
Yeah.
The issue should be, okay, we recognize that you're having issues here. How can we resolve them for you, your family, and all the other residents in this facility?
I guess
that attitude is missing.
Yeah, the consultation is an interesting point, and I guess it should be handled because we are indeed entrusting our loved ones' care and comfort to someone else. But when we assess a patient, I assume that the medical professionals, and even if they are strapped and short on staff and resources to appropriately take care of one person with a different set of needs than another, is one thing, but the family will always demand a certain level of care which may, one, not be required, and two, may not be possible. So I think the medical professionals should be able to assess a patient's needs, and they've obviously dropped the ball themselves, and they harm their own reputation, that of Eastern Health, the facility itself, when we have a gentleman who has been bedridden for 36 straight hours.
And I think that, and you bring up an issue of the healthcare professionals assessing the patient needs, and I agree entirely with that. It has to be the medical professional that has the final say on what the patient needs are. But then you have the problem the day after. which is the administration of those needs. And that's where things start to go. That's when things can start to go south. When you don't have enough staff, when you don't have the staff managed and deployed properly, then the administration of those needs becomes a problem. It's fine for a doctor to say, okay, this person needs to be taken out of bed every 12 hours, needs to be put in a chair, or needs to be walked about, and we do that kind of thing because we eliminate bed sores, and it creates, mental stimulation to hold off dementia, those kinds of things. Signs off on that.
Yeah.
But then what happens next week or next month when this is not carried through? And it's the carry through that a lot of the issues come out of. The lack of carry through, actually, to be more exact.
Yeah, because, just because there's been an initial consultation and or assessment doesn't mean necessarily that level of care will happen every single day, week after week, month after month. That's a fair point and fair comment. Anything else, Simon, before we run out of time?
No, well, I'm just going to, just to pivot very quickly. This is a new year. We're going to be looking at provincial elections coming up. We're going to be looking at the nomination of Signal Hill Kitty Vitty. And I just want to let people know in the district that, we're going to be busy and we're going to be active thanks to, more snow than anybody really wants to have. We're going to be focusing a lot on phone calls. We're going to be doing telephone canvasses across the district. So if you receive a phone call from myself or from some people attached to our campaign, from volunteers, don't be surprised. The nomination is coming, and we're looking to find out what you think and where your minds are, so that we can do better for all of us.
And sometimes people are put off, so it's always tricky how you campaign when you use a phone. People don't necessarily react negatively to a knock on the door, but the phone is tricky, so I think it's a good heads up to give people. And obviously, Signal Hill Kitty Vitty has become far more interesting in the past week than it was prior. So, Simon, wish you good luck on the campaign trail, and thanks for your call.
Thank you very much, sir, and take care of yourself.
And thank you very much. Bye-bye.
Bye-bye.